Emotional stress, then disturbed sleep can cause multiple ulcers in your oral cavity. Cheek bite, lip bite or tongue bite होता है. So because of that bite we get ulceration. So having a good vitamin supplement is also a recovering factor in case of mouth ulcers.
Hello and welcome to yet another episode of Dental Talks with Dr. Snehal Dhatrak, proudly brought to you by MyOrl-Care Pvt Ltd. Hi, I'm Christine Zerek and I'm so happy to be here and thank you for being with us because we always cover important topics and awareness on dental hygiene. Today we're going to talk about something I'm sure most of you have experienced. Sometimes you find discomfort in your mouth, sometimes there's a burning sensation, sometimes you just can't eat hot food or even mildly spicy food. What is it? Yes, you got that right. Mouth ulcers. It's something that really makes us so uncomfortable, right? Now we're going to talk about the causes, symptoms and what can be done for it to be treated. So are you set for today's episode? So let's dive deep in. All right, doctor, so good to have you here and thank you for always sharing your wisdom. So let's talk about this conversation on mouth ulcers. Tell us all that we need to know about it.
Yes, Christine, thank you for introducing me and today's topic. It is a very common situation which all of us face very frequently. So let's address it today. Let's know something about mouth ulcers. So there are three different types of mouth ulcers present. One is minor ulcer, major ulcers and herpetoform ulcers. So minor ulcer is something which is very small in size, around 5 millimeter in size. It heals of its own within 7 to 10 days. Major ulcers are quite bigger in size, so it is around 1 centimeter, quite deep and it is painful too. It gives lot of burning sensation and it takes several weeks to get healed. The third ulcer is herpetoform ulcer. It is mainly because of viral origin. If any viral infection is there like herpes, then you get multiple pinpoint ulcers at a time. Sometimes it covers entire cheek, sometimes it covers entire lips. So these are herpetoform ulcers. Now let's understand etiology behind it. Etiology means इसके कारण क्या है कि क्या क्या फैक्टर्स है अपनी बॉडी में जो आपके मुंह में माउथ अल्सर्स ला सकते हैं. सबसे पहला और कॉमन फैक्टर जो है दैट इज़ ट्रॉमा, बाइट ट्रॉमा मीन्स सडनली एक्सीडेंटली चिक बाइट, लिप बाइट और टंग बाइट होता है. So because of that bite we get ulceration, but these ulcers get healed within a week with some ointment and other medications. Then the second ulcer is sharp tooth ulcer. This can be very dangerous if not treated on time. Then the third cause of ulcers is systemic conditions like uncontrolled diabetes, autoimmune diseases like lupus. So autoimmune conditions have major ulcers in oral cavity. Then the next reason for mouth ulcers is stress. Emotional stress, then disturbed sleep can cause multiple ulcers in your oral cavity. Hormonal changes, especially in females, menstruation, menopause, sometimes leads to ulceration in oral cavity. Apart from this, there could be some allergy to some kind of medications like NSAIDs, non-steroidal anti-inflammatory drugs, which are mainly painkillers. Then beta blockers and post chemotherapy in cancer patients can also lead to have multiple ulcers in oral cavity. Then when you get viral infection like herpes, as we have already said, this also leads to multiple form of ulcers in your oral cavity. Brushing very harshly with very abrasive toothpaste sometimes leads to ulceration on your gingiva or gums. So be careful while choosing your toothbrush. It has to be soft and you should brush it gently. Now these were all various reasons for having mouth ulcers in your oral cavity. Now the next concern is what would be the treatment if you get ulcers. So first we should start with the symptomatic relief, which could be using an ointment, a pain relief ointment like benzocaine, lidocaine, which has a soothing or numb effect on the ulcers. So you can apply it before food so that it won't give you a burning sensation. खाने से पहले अगर आप ये ointment लगाते हो ulcers पे तो आप अच्छे से खाना खा सकते हो till the time it heals. Then if the ulcer is quite bigger in size, like major ulcers, you may have corticosteroidal ointment which is applied after the food. So उससे भी healing चालू होता है progressively. Then you should have anti-inflammatory mouthwashes like betadine, chlorhexidine mouthwashes, which will help ulcers to heal properly. Then another form of ulcer is because of nutritional deficiency like vitamin B12, iron deficiency, folic acid deficiency leads to multiple ulcers in oral cavity. So having a good vitamin supplement is also a recovering factor in case of mouth ulcers. Like if you take a supplement when you have ulcers, especially complex vitamin B12 supplements, it triggers the healing process of ulcers.
Okay, so doctor, before you proceed, I just want to know when is the best time for a patient to go and visit their dentist regarding mouth ulcers?
Mouth ulcers, yes, surely. So if the mouth ulcer stays in your mouth for more than 2 weeks, then definitely you should have opinion of your dentist or medical practitioner, especially in cases of tobacco, gutka and pan chewer patients, because these ulcers are quite tricky and they need to rule out with biopsy and other testing as well. So 2 हफ्ते से ज़्यादा अगर मुंह में आपके अल्सर्स रह रहे तो definitely you should not try treating it at home by your own. You need to have a proper consultation from either dentist or treating medical physicians.
Okay, and I also want to know the role of water and hydration. So lack of hydration, does that also cause ulcers, or does it help heal ulcers? Does that have any connection?
Yeah, like dehydration gives bad breath, but,
right. But not really
causes ulcers. But dehydration will hamper the healing process.
Okay.
It delays the healing process of ulcers. Having plenty of water will help to
heal it
faster.
Okay,
yeah.
And even having spicy food, does that aggravate? Now, aggravate of course, but does it cause? Because some people love eating chili and spicy food. So does that also cause that, you know, friction and irritation
so
in the mouth?
Spicy food triggers your acidity, and acidity causes ulceration sometimes. Most of the people are very sensitive.
Right.
So hyperacidity may cause ulcerations.
Fantastic. Wow. So thank you so much for that. I hope that this episode cleared a lot of your doubts. It definitely cleared a lot of mine regarding mouth ulcers. It's something a lot of people face, and sometimes we don't even know why, right? We get these ulcers. But today, thanks to doctor, all of that has been cleared. If you resonate, if you like what you're watching, and if you feel others should also get this information from us, please do like, share, and subscribe to our channel, and we really value your support. So thank you so much. And doctor, as always, your last words of wisdom for us.
Yes, of course. Just remember, treat ulcers early to have pain-free smile. So keep smiling.